Hello, good afternoon, everyone. Welcome to Stop COVID Deaths. Today, we are going to talk about the science and the process behind boosting and the recommendations that have been made by the Health Technology Assessment Council. I think this has been discussed in the news. There are lots of opinions about boosting, when it should be done, and the timing and all of that. So we are going to talk about that a little bit more today. I'm Susie Pineda Mercado, your co-host. I know you're missing the opening from Raymond. Unfortunately, he can't be with us today, but instead we have someone who I've worked with and have enjoyed working with for a number of years, and who you know, and who is going to help me shepherd the process for today. He's known for his work in health promotion and mental health, and he's a public health expert in those fields, and he's, I would say, one of the most what should I say, one of the most ano bang word gagamitin ko? Isa sa pinakamahusay nating health communicator in his generation.
Wow.
And yeah, so we're very happy to have with us today who co-founded a number of things. So he's Director of Development Communication at Organic Intelligence. And he's also co-founder of Protect the Frontline, a community campaign to mobilize equipment for COVID-19 at the beginning of the pandemic. So welcome, Dr. Jason or Ace Ligot. Ace, welcome.
Thank you so much, Doc Susie. Good afternoon to you and good afternoon to all of our viewers today. Inisip ko nga, Doc Susie, before today's webinar, the first time you invited me, I was a reactant. The second time, naging panelist na. Ngayon, co-host na. So every time bumabalik ako dito, parang napopromote yung role ko.
Oh,
so,
tama. Marami ka pang gagawin.
Thank you so much to all of our participants who are joining us here on the Zoom webinar, and to all of you who are watching via live streaming on the TVUP YouTube channel, as well as on the UP System Facebook page, the TVUP Facebook page, and the Stop COVID Deaths Facebook page. Talaga naman, Doc Susie, we are all over on social media today. Now, for those of you who are wondering, sabi nga ni Doc Susie, for this episode, Dr. Raymond Sarmiento is unable to join us. But don't worry, Doc Raymond will be back next week. Now, as you have seen in our opening billboard, mas naging malawak na ngayon yung discussion natin during this Stop COVID Deaths webinar. And we have transitioned to broader discussions on how the pandemic has affected health outcomes beyond COVID-19. So yes, while the title of our webinar remains the same, Stop COVID Deaths, we have expanded our discussions to include C, current COVID-19 problems, and we'll be talking about that today. Very timely topic on boosters, but expect also discussions on O, other outbreaks, V, viruses, I, infections, and D, disasters. Hence, our webinar now continues to level up to take a closer look at other emerging health problems in the community, while we keep an eye out for COVID-19 developments here in the Philippines and in the rest of the world. Now, speaking of, Doc Susie, I know our viewers, they like to keep abreast of the latest news in health and medicine here and abroad. So we have a new segment. Doc Susie, what's our new segment?
Okay, so just to provide everyone with updates on news in medicine and health from here and from around the world, we have a segment called the News Update. Okay, Ace.
Okay,
maybe you should give the first Ikaw
Oo
muna.
nga, pati yung background natin para tayong nasa news na talaga ngayon, no? Balitang-balita, mainit na balita. Okay, now our first news update is an article that was actually published on WebMD recently. The article was entitled "Boost Now or Best to Wait?" A very important question, very relevant to our discussion today, and I think maybe that's a question we should pose to our experts later on. Now, the article goes on to explain that we are seeing some emerging seasonality in COVID-19, at least in places like America and Europe, where we seem to have a lot of cases during, for example, the summer months, where people are traveling, they're going on holidays, on vacation, and also during the winter months. So the article goes on to ask also, is it best to wait? And why should you wait at all? because apparently there are new vaccines that are currently in development that will cover for more than one variant of COVID-19, including the more contagious Omicron variant. So should I boost now, or is it best to wait for these new vaccines? Let's go back to that question later on during the panel discussion. Over to you naman, Doc Susie. Anong balita ang nasagap mo today?
Well, actually, our audience knows this already, that Stop COVID Deaths got the Gold Quill Award. And finally, the International Gold Quill Award. This is given by the International Association of Business Communicators. But finally, the award was physically received in New York City. Let's watch this.
This is great public service because the resources, the human and the research resources of the university are put into a good spot, and they have contributed to the solution of COVID in our country. Our audiences are from all over the world. So I dare say that our contribution is not only to our country, but to the healthcare of COVID worldwide.
We have viewers actually from 10 countries watching us regularly. So it's a recognition of what the Philippines can do for the Filipinos in the Philippines and the rest of the world.
We did what we have to do, the best we can. The award is a bonus.
Okay, so that's our news that was covered by ABS-CBN TV Patrol, but was shot in New York. And again, thank you to everybody for making this award possible. So that's our news for the week. We'll be back next Friday with more news for you. Okay, let's continue with our program. Teka muna, Raymond, and guys in the Zoom. I have COVID.
Oh.
This is my 5th day. And I just want, everyone to know that it was really so bad in the first, for me, no, maybe, kasi I have comorbidity, I'm asthmatic, no. So, actually, kung makikita nyo ako about 4 days ago, talagang wala. Hindi ako makabangon sa sakit ng katawan. I had fever, chills, and even vomiting. So, I don't know, this conversation on boosters is very, very important, no? Kasi kung ako, I'm vaxxed and boosted,
right.
Ganyan yung reaction ko sa COVID. Paano yung mga hindi vaccinated? Hindi ba? Mukhang marami pang hindi vaccinated ngayon, ano? Sinasabi nga na in some parts of the country, the primary vaccination could be as low as 20%.
Right.
And while our cities in Metro Manila have a bigger coverage, kulang eh. We have to have everyone vaccinated. And the reason nga is ito nga, it's no joke to get COVID. Some people, so sabi ko nga, Ace, parang it was a household transmission for me. So yung anak ko na nag-gym, nakuha niya sa gym, siya, tulog lang siya ng tulog, wala naman siyang dinadaing. Ako naman, my goodness, hindi ako mapakali. Nilalagnat ako, alam mo, parang I closed the doors, closed the electric fan, at nakakumot pa ako dahil nanginginig ako sa chills. So people have different reactions to it, and I do not want to do that again. Ace, it was so difficult.
I've had COVID myself. In fact, when I got it, I was admitted to the hospital. So I know, that
You're
was
hospitalized.
ano pa yun? Siguro, Delta variant pa yun, but one of the earlier variants. So it was really, I can totally relate, and I'm sorry to hear, Doc Susie. But I trust that you're on the mend, that you're feeling better now.
Yeah, I'm better. I'm better naman siya.
Tingnan mo naman yung makeup natin, di ba? Talagang... But, you raise a very important point. And I think that's something that people should continue to be aware. The pandemic teaches us talaga vigilance and frankly, a little patience, right? That while, yes, we continue to learn more about the virus and we have all of these new medicines and vaccines available, that is no excuse for us to let our guard down because you can never tell. As you've said, di ba, yung anak mo, okay lang.
Wala. Tulog lang ng
Knock
tulog
on wood, mabuti na lang.
20 years old.
Oo nga, very
bata
mild. Yeah.
Ay, tulog lang ng tulog. So I said, ano ba to? Parang ako naman, parang I don't know, the one
Mm.
that really got me was when I started throwing up. Nung sumusuka na ako,
Yeah.
nalulula,
Mm-mm.
parang eto na, sabi ko, how bad is this going to get? Kasi
Right.
dahil naduduwal ako at saka nagsusuka ako, sabi ko, parang baka hindi ako kumain. Right? Baka kailangan akong iswero, parang ganon. So, I don't know, I mean, I think you're right is, actually the pandemic is not over. And
Right.
yung parang flu lang yan. Maybe for some, but I tell you, for me, it was not like a mild thing at all. This happened, yung sa'yo is, your father was also sick at that time, di ba?
Yes. So we got ours last year in May. So magkatabi kami ng kwarto actually. So syempre we had to, pinaghiwalay kami. I was taking care of him initially. Tapos nung nagka-COVID siya, ako nagka-COVID na rin. Magkahiwalay kami. It was a I would say it was really a life-changing experience, to be frank. But with the help of our colleagues, I cannot thank you enough. So siguro special shout out na lang to the medical city and the wonderful doctors there who took care of me. But having gone through severe COVID myself, it's really no joke. Which is why I think it's very timely, that we're having these discussions, because now I feel there's a sense of complacency maybe in people.
Yeah.
As we see that, and it's not a bad thing that we're opening the economy, obviously, and people are being mobile. But there are ways that we can continue to keep ourselves safe while we navigate this gas-gas na, but this new or now normal under the current conditions.
Yeah, I think, parang there might be other variants that will come up. This Omicron, they said it's more transmissible but less severe. So sabi ko, ito na ba yung less severe? Well, I don't want to know what severe
is.
Yeah.
Oo nga.
Anyway, so yeah, go ahead, Ace.
No, I was just gonna say, Doc Susie, now, maybe to provide some context to our discussion today, we actually wanted to hear from actual people, what are they thinking about COVID-19 and vaccines and boosters? Ano bang nasa saloobin ng mga tao, mga kapwa Pilipino natin? So, before we go to our discussion, why don't we watch this short video presentation put together by TVUP?
Sa tingin ko, base sa experience ko, kailangan ng first dose, second dose at booster. Kasi nung nagkaroon ako ng second dose, hindi pa rin ako naging immune sa COVID-19. Pero nung na-booster na ako, ayun na, naging safe na ako all throughout ng mga tests ko, both antigen at RT-PCR.
To be honest, hindi talaga ako aware kung ano ba yung tamang bilang, kung ilan yung bakuna na kailangan para labanan yung COVID-19. Masyado na tiwala ngayon sa ating mga health professional. So kung ilan ang ina-advise nila na kailangan nating bakuna para labanan itong COVID-19, ayun, dahil sa sobrang trust ko sa kanila, sumusunod na lang ako doon.
Kailangan din natin ng patuloy din na, kung nag-upgrade yung virus, syempre dapat mag-upgrade din yung antivirus or vaccine.
Ang kailangan ay 2 bakuna. Una ay para makapag-build yung katawan natin ng immune response. At yung pangalawa ay para for extra protection.
Hindi pa ako nakaka-second booster kasi meron akong health concern. Pero honestly sa akin, kung wala akong health concern ngayon, papa-second booster na ako.
Nakikita ng ating mga medical professionals na mahalaga na magkaroon ng booster shot para mas lalo pa natin makontrol yung pandemic. At hopefully maging endemic na lang siya in the future at mawala na rin siya tuluyan. Open naman po ako sa patuloy na pagkakaroon ng mga booster shot.
Sumusunod na lang ako sa nila kasi sila ngayon nakapag-aral na yun.
Naiintindihan ko yung dahilan bakit kailangan marami yung booster shots. Una kasi yung COVID-19 virus, mabilis siya mag-mutate. So, kailangan nare-refresh yung immune memory natin para labanan yung virus.
Nung first go, ito yung medyo malala yung naging effect. Pero eventually, sa mga susunod ko na shots, naging okay naman na. Parang feeling ko, kilala na ng katawan ko yung vaccine na ito. So, madali na ako nakakapag-shots.
Naiintindihan ko yung iba na may vaccine hesitancy sila kung meron silang medical health concern. Pero kung wala na rin naman po, ay sana po ay maging open po tayo para din po sa kaligtasan natin at sa kaligtasan ng ating mga mahal sa buhay.
Thank you very much, TVUP, for that. It's always good to get the view of ordinary people. It sort of also helps our speakers frame some of the messages that they will give when they make their presentations later. I think people want to know about the certificates of attendance.
Yes, Doc Susie. For those of you who are wondering, certificates of attendance will be issued as long as you've watched at least 50% of the entire webinar duration. So for those of you who are watching and would like to get a certificate, please watch at least half of the program para naman po masulit rin natin yung pag-uusapan natin today. Okay, so on that note, Doc Susie, why don't we get this show on the road and start our presentation proper?
Yes, let's go to our presentation proper. So usually we start out with, okay, ano ba to? We will have the format of our panel of our discussion, and we've got really some very good, as usual,
Super
experts to speak, who will give some presentations. Want to talk about the format, Raymond?
Yes.
Raymond. Nako talaga na Raymond.
No problem.
Alam mo, mali-mali talaga ako isip.
Okay lang. Totally understand. Considering the context.
The audience, no? Kasi binabati ko kayo, di ba, in the beginning of the webinar. Actually, binati ko kayo pero hindi nakalagay to everyone.
Ayun
Parang
lang.
nakalagay to the host and panelists. So sorry everyone, I was greeting you usually. And I was saying, ano ba to? Meron pa akong mga tinatanong, walang sumasagot. Wala, talagang ang lola nyo may sakit. So okay lang.
No problem,
Okay.
Doc Susie. Alalay
Sige,
lang
go
tayo today. Actually, in this episode of Stop COVID Deaths, we will discuss COVID-19 vaccination with experts who have studied various aspects of prioritization of the boosters in the Philippines and the role of frontline health workers in improving vaccination coverage throughout the country. Now, for our webinar today, we will have a standard panel discussion. Ibig pong sabihin, after our speakers have presented, we will have a Q&A session later on in the program where we will entertain questions from Zoom, Facebook, and YouTube. So, sa lahat po ng kasama natin today in the Zoom webinar, please input your questions po in the Q&A or in the chat box. If you're joining us on social media, use the comment section and we will try to get to as many questions as possible later on. Now, Doc Susie, bago tayo mag-start sa webinar, balita ko meron tayong fun quiz. Ano ba itong fun quiz na ito?
Sige, let's introduce the fun quiz, TVUP. Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na! Okay, so let's go. Oh, diba? We named
Doc Susie
ourselves.
and Doc Radar. Okay. So, for those of you who are joining us on Zoom, meron na po tayong poll question there. So, nakikita nyo na po yan. For those of you who are joining us on social media, you can just go to slido.com, input the code below, or scan the QR code to bring you to our interactive quiz today. Okay, so unang-una sa lahat, question number 1. Alin ang magbibigay ng mas mataas na COVID-19 immunity? Is it, single answer lang po, pili lang po ng isa. Is it natural infection or COVID-19 booster? Ayan, may mga dumadating na ng mga answers, no? So while you think about your answer to that question, gusto lang nating batiin in some of our local viewers today. We have viewers from Ilocos Sur, the Kinarayan Elementary School. Hello, magandang hapon po sa inyong lahat. From Dagupan, Pangasinan. From the Social Security System in Naga City. Hello, good afternoon. From Western Visayas Medical Center in Iloilo, Cebu City Medical Center in Cebu, Zamboanga City Health Office, Zamboanga del Sur. And I saw a couple more people joining us, rather saying hello on the chat. Magandang hapon po sa inyong lahat. Thank you so much for spending your lunchtime hour with us today. Okay, so question number 2 naman. Sino ang dapat unahin sa COVID-19 booster? Maaari pong pumili ng more than one. So you can choose more than one answer for this second question. Is it the immunocompromised? Is it the seniors, the healthcare workers, our economic frontliners, or our students and teachers? So isip-isip po. You can pick more than one answer for this second question. Now, while we're waiting for people to answer our poll, we just like to say hello, mabuhay to all our viewers from all over the world. Tulad nga po nung narinig natin during the news updates, this webinar is being viewed not just in the Philippines, but actually in other countries. So we'd like to say a warm hello to the Suri Seri Begawan Hospital in Brunei, to our viewers from Bangkok, Thailand, from Kanto City, Vietnam, from the university in Algeria, the University of Hail in Saudi Arabia. I don't know if I said that correctly. I'm sorry if I made a mistake. The Philippine Nurses Association from Edmonton, Alberta, Canada. I think it's midnight in Canada right now. So thank you for those of you who are watching. Viewers from LA, from Grenada, from England, from the Netherlands. Wow, grabe Doc Susie, international na talaga ang webinar natin today. Okay, so we will leave this Zoom poll and Slido open as we continue with our program. So if you want to change your answer or later on, parang sa kanya na gustong sagutin, that's fine. Our speakers will actually comment on the results of this poll and we'll have a bit of a discussion around that later on. Okay, so back to you, Doc Susie. Please introduce our first speaker for today.
Thank you so much, Ace, and thank you to our expert speakers today who actually helped us put the questions together. Actually, we do discuss really what questions to ask you. Kasi ano ito, sabi natin fun quiz, but we really want you to walk away from the webinar with, just a couple of very focused points,
right?
So that you will be able to help answer questions also when they come your way as frontliners. No? So actually, for today, we have a great lineup of speakers. And I think the thing is, when it comes to the question of boosting, some of the issues really fall around the fact that there are many who still have not received their primary vaccination. And I think that's why I also went a little bit into how difficult it is to get COVID. It's unpredictable. You don't know who's going to get mild, what kind of symptoms you get, and so on. So as much as possible, we want everybody to be vaccinated. At the same time, people are clamoring to have access to the booster. So our speaker for today, our main speaker, nako, haligi po ito ng medisina dito sa ating bansa. She's former Dean of the College of Medicine, former Chancellor of UP Manila, and currently, I would say in the hot seat as the chair of the core committee of the Health Technology Assessment Council, or HTAC. HTAC, which was created, alam niyo po yung HTAC, yung Health Technology Assessment Council, wala po yan noon. Napatupad lang yan dahil sa batas ng Universal Healthcare Act na created this. And she will talk also a little bit about the role of HTAC, but she is leading the HTAC and really a very esteemed and I would say revered professor at the UP College of Medicine, Dr. Marita Tolentino-Reyes. Ma'am Marita, welcome. Ma'am, nasa na kayo?
Good afternoon po, ma'am. I think you're on mute po. Ayan.
Ayun. Hi,
Okay.
ma'am. Welcome
Hello,
to the
ma'am.
webinar, and thank you for joining us today.
Thank you. Thank you, Susie, for very nice introduction. Natatandaan ko pa when you were a student.
Ako patay. Kasi laging nasa dinidiscuss sa academic committee, di ba yung mga bumabagsak?
But anyway, thank you to TVUP for this opportunity to let you know about HTAC better, where its mandate is coming from, how it is organized, and how it fulfills its mandate, especially how it formulated the different recommendations on vaccines. So that will be the first part of my presentation. The second part will be a brief review of the human immune response system and how this is harnessed in vaccination. So may I have the first slide, please? Next slide.
Okay, there we go. Okay na po, ma'am. Go ahead.
So, okay. The HTAC mandate is described, as mentioned by Susie, Dr. Susie, in the Universal Healthcare Act of 2019. That stipulated that the setting of priorities to guide coverage decisions of DOH and PhilHealth shall be through health technology assessment. So, kailangan may health technology assessment before the DOH or PhilHealth will decide whether to procure or to include in a benefit package. Thus, the council was created to conduct health technology assessment and be a recommendatory body to the Department of Health and PhilHealth. It also stipulated that it shall be supported by a division consisting of 3 units: the Technical Secretariat, the Administrative Unit, and the Policy, Planning, and Evaluation Unit. Next slide, please. Next slide. Here is the HTAC structure in relation to the different stages of decision-making: evidence generation, recommendation, and final decision. The evidence generation, as you can see, evidence is generated by the HTA division. It's also assisted by what we call the HTA Research Network. The evidence generated will then be assessed by the corresponding subcommittee, any of the 7 subcommittees, depending on the type of health technology that is being assessed. And finally, the recommendation is finalized at the level of the core committee, which then submits this to the decision makers, who can be the Secretary of Health, or the DOH Executive Committee, or the PhilHealth Board of Directors. Okay, next slide, please. In this slide, we show a process chain, showing 7 agencies that participate in the final decision of whether the vaccine will be rolled out or not. First, we have the vaccine expert panel that advises the Food and Drug Administration on whether there is scientific soundness in what the vaccine manufacturers are claiming. So then the FDA will decide whether it is quality, there is quality in manufacturing, whether there is efficacy and safety, and issue an emergency use authorization or a product registration, a certificate of product registration for marketing. So only then will the HTAC be able to recommend, after it has determined whether the procurement of the vaccine or its inclusion in the benefit package of PhilHealth will be cost-effective, viable, affordable, promotive of equity, considerate of community values, and responsive to the requirements of the health system. Next slide, please. All right, so that introduces HTAC. Now we got to the basics of the immune response and its application to the vaccination strategy. Here is a very simplified overview of the human response system. What is shown here is really what we call the adaptive immune response that kicks off when the disease-causing organism, here it is depicted as the as the SARS-CoV-2 Omicron. If this organism survives the first and second lines of defense of the body. What is the first line? The first line is the skin and the mucous membranes that prevents entry, while the second line of defense consists of white blood cells, antimicrobial proteins, and other cells that cause inflammation to prevent the spread of the pathogen. So in this case, it shows that the Omicron has survived the first and second lines of defense. And so now the body will have to kick off its third line of defense, and that is the adaptive immune response. This is the adaptive immune response. What is the message? The message here is that the immune response system is a complex network of cells. Ang daming cells dyan, naka-drawing, no? And we can divide the cells into those inside the tissues. So we call this the cell-mediated immunity. And those circulating in the blood. So we call this the humoral immunity. So in the humoral immunity, and that is what we are most familiar with, the end result would be the production of antibodies by the plasma cells. No? But in addition to plasma cells, we also generate the memory B cells. And how long the memory cells stays and how long the antibodies will last will determine the duration of protection against the pathogen. This is under the natural immunity, meaning during the natural infection. In the cell-mediated immunity, we talk about the CD8 T cells. These are inside the tissues, no? And stimulation of this would bring about the generation of the cytotoxic T cell and also the memory T cell. And the difference between the cytotoxic T cell and the plasma cell is that the cytotoxic T cell directly lyses the infected cell, the infected cells by its granzyme, by enzymes, by perforin, by interferon gamma, no? And lyses the cell. So it is therefore important to remember that we are not only interested in antibodies, we are also interested in the cell-mediated immunity, except that measurement of the cell-mediated immunity is more complex, more difficult than just testing on antibodies in the circulation. Okay, next slide, please. Now, what we have here is a graphical representation of the changes in the concentration of antibodies in circulation in relation to the time of infection. So here, the zero time, this will be the number of days from, let's say this is the infection, the 11 days, no? And this will be the anti-level levels in the y-axis, no? So what we can show here is this: the first antibody to be generated would be the IgM antibody, the red line. And it comes something like 7 days after the actual infection, or even more, or 11 days after the actual infection. And that the IgG antibody will come after the IgM. But what we see here is that the IgM antibody quickly also decreases, while the IgG antibody goes beyond the levels of the IgM antibody and persists. No? Now, what do the IgG antibody does? The antibody actually defends against extracellular pathogens by binding to the pathogen and making them easier targets to phagocytes and the complement system in the circulation. On the other hand, the cytotoxic cells defend against intracellular pathogens, including cancer cells, by binding to and lysing the infected cells, or as I said, the cancer cells. All right, so what are the take-home messages in this slide? There is a lag time between the actual infection and the increase in antibodies. So you have what you call the incubation period, and that the IgM levels rise first, but goes down quickly after 4 to 5 weeks, and that the IgG levels rises about a week after the beginning of IgM, but it is higher and is sustained for a longer period of time, and therefore provides longer-term immunity. Next slide, please. how does the detection of antibodies relate with the clinical symptoms? All right. Now, so here, the blue line would represent the levels of antigen that can be detected in the system. No? So blue line, levels of antigen or pathogen. The green line is the IgM antibody, and the red line would be the IgG. You are now familiar with these two curves, no? The IgM and the IgG, because we showed that earlier. But here in this slide, we show the trajectory of the pathogen increasing, no? At the same time, we mark off the stages of the disease. So here we have the asymptomatic stage. So what does this mean? That the pathogen has already infected the cell, but the person may still be asymptomatic. So ito, hindi natin alam what's going on. No? The person doesn't know na in fact that he or she is infected. Then there is an onset of symptoms because the pathogen has reached a level that will affect onset of symptoms. But look at this, there is also the IgM does not start right away. The IgM starts even after the onset of symptoms. So wala pang IgM that will be detected at the moment, nor even the IgG. But the pathogen can be detected by the RT-PCR. This is where the RT-PCR is used, no? Because at this point, even somewhere at this point, the RT-PCR will all be positive. So as you can see, when the patient begins to recover, that's the time when the pathogen goes down. But even then, the IgM also goes down, but the IgG is still up. So you still have the positive IgG antibodies even after the patient recovers. Now, what happens if the patient does not recover? So the patient, this means that the immune response that was mounted by the person was not enough to demolish the pathogen, and therefore the body systems give up and the patient dies. Next slide, please. So all the while, so we are showing therefore that the vaccine here, earlier we showed the human response when there is an infection. Here we are showing the response when we have a vaccination. As you can see, the vaccination mimics an infection. So we can look at this graph up to here before the booster dose. So again, there is your IgM and there is your IgG, no, as the response of the body. But based on studies, the level of serum titers of antibodies with vaccination is higher than the level of antibodies when you have infection. All right, so next slide. So therefore, the purpose of vaccines is to save lives by providing strong protection against serious illness, hospitalization, and death. Notice that we did not say against infection, because it is possible that you still have infection, but it will protect against serious illness, hospitalization, and death. And there is evidence also that shows that it will be less likely to pass on the virus if you are vaccinated, and therefore it protects the people around the vaccinated. Next slide, please. Therefore, in determining the effectivity of vaccines, we usually look for data comparing the risk of having symptomatic COVID among the vaccinated and among the unvaccinated, the risk of hospitalization among the vaccinated and among the unvaccinated. And here we see a data from Wisconsin. It's showing that for every 100,000 fully vaccinated people, 125 or 12.5% will become cases or be positive for COVID. 4.9 will be hospitalized people, 4.9 or 0.49% will be hospitalized, so that's very small. And 0.1 in 100,000, that means you need a million to record one death among the vaccinated. In contrast, among 100,000 not fully vaccinated people, 369.2 were recorded as COVID cases, 18.2 were recorded as were hospitalized, and 1.1 people died among the 100,000 which were not fully vaccinated. Now let's look at our COVID data tracker, and this tracks or records the number of hospitalizations based on vaccination status between February and August. So in August, I think this was about the height of the COVID, among the vaccinated, there were, in 100,000, there were 4.5 recorded vaccinated people who were hospitalized, but there were 83.6 unvaccinated among 100,000 population that were hospitalized. So it's still very high if you are unvaccinated. Next slide, please. I'm sorry for that. The person who's going to answer will be, I cannot reach him. So the telephone will ring until he gets his attention. Okay, next slide, please. Next slide, please. So what happens? So now we're talking about the booster dose. In receiving a booster dose, that you still have a higher, when the IgG is already declining, you give a booster dose, the secondary response is a much higher level of IgG, and also, but the IgM is more or less the same. I'm sorry, I'll have to stand up and.
Ma'am, go ahead. Okay lang yan. Go ahead.
You can hear? Okay.
Yeah, ma'am, it's okay. If you want to unplug the phone or answer it, go ahead po. It's okay.
Paolo, please answer.
Okay. Okay lang po yun, ma'am. Go ahead.
So now, so as you can see, receiving a booster dose gives a much higher response as far as IgG levels is concerned compared to the primary vaccination. The high, it's much higher. So better protection. Okay, next slide, please. So, so it shows here, so here in this slide, we're differentiating a 3-dose primary series that is recommended for immunocompromised people, and we're differentiating the 3rd dose as already a booster for the non-immunocompromised people. So the 3rd dose is still part of the primary series for immunocompromised persons. But the 3rd dose is already the first booster for the non-immunocompromised people. No? Why are immunocompromised people given a 3rd dose in its primary series? Because studies show that the effectiveness and immunogenicity reaction of the immunocompromised persons to the vaccine is lower, no? And therefore, it is suggested that we have an extended primary series to enhance immune response. Okay. Now, why are we giving as a first booster for non-immunocompromised people? Because there is waning protection against infection over time, because of the emergence of variants where there may be reduced protection, and because it also may be possible that there is inadequate protection from whatever vaccine you receive in the primary series. Okay, next slide, please. So this is just a repeat of the definition that when we say booster dose, we're talking of a dose of vaccine administered when the initial sufficient immune response have waned over time. So meaning the initial response is sufficient, but we know that it will wane, so we give a booster dose. Whereas for the immunocompromised, we give an additional dose. We don't call it booster. We say it is the third dose or additional dose, because the initial immune response after the first 2 doses is likely to be insufficient. Next slide, please. All right, so again, this is to emphasize that if this is your primary series, there is protection, but it fades. The protection fades by 4 to 6 months for the symptomatic infection. So there is still protection, but it fades for symptomatic infection. Thankfully, for the severe disease, protection is still sustained. But it is good to have booster because the protection will be more sustained and it will be higher because it improves protection. And it says that confers 89% protection on the average for severe disease and hospitalization. And again, but look, even the booster dose is going down. So we'll probably be talking of the second booster. Okay. Next slide, please. So again, this slide shows that when there is an emergence of a variant like this one, no, from 2020 to August 2022 to August 2021, more or less, no, there is sustained effectivity, vaccine effectivity for the mRNA, for the protein subunit, for the inactivated vaccine, for the viral vectors, but there is a sudden dip in December of 2021 when the Omicron variant became dominant among the different variants. So this is where we said, yes, you need a booster, especially because there are emerging variants of concern. That is my last slide, but in summary, vaccines give protection against severe disease, hospitalization, and death. And in addition, vaccines prevent spread of the infection to people around the vaccinated. Thank you very much.
Thank you very much, Dr. Marita Reyes. No? I don't know, you can see all the hands, the hearts, the clapping coming from our audience, no? Talagang napakalinaw, no? Naalala ko parang nasa biochem class ako ni Ma'am Marita. Talagang ganda, malinaw na malinaw.
Yes, memories of med school indeed.
Yeah, very, very clear. But I think we always need to be reminded of those basic principles. Kasi with social media and all of the disinformation going around, if we don't understand those very fundamental principles that Chancellor Marita mentioned, no, talked about or reminded us about, it's very easy to lose your path, to lose your track, no, and to not be grounded in the science or the scientific principles. So thank you very much, Ma'am Marita. Makikita nyo, tuntua yung ating mga audience sa
Oo nga, daming reactions.
Later on in the question and answer portion, you can also put in your questions and in the Q&A box, no? Okay, we have another presentation that Ace is going to cue. Ace, go ahead.
Indeed. Thank you again, Doc Marita, for that very comprehensive presentation. And we look forward already to the Q&A session. I'm sure we'll get a lot of very interesting questions on some of those fundamental concepts that you reviewed earlier on. So now it is my pleasure to introduce our next speaker, who will be delivering a video lecture. He is the Subcommittee Chair on the Prevention and Promotive Health Services, also from HTAC. So please welcome to your screens Dr. Limuel Anthony Abrogena.
Good afternoon. I am tasked to discuss the science behind the HTAC recommendations for the COVID-19 vaccines. Let me begin by showing to you the evaluation framework used by the HTAC in its assessment of the COVID-19 vaccines. Aside from safety and efficacy, we also consider responsiveness to magnitude and severity, affordability and viability, household financial impact, social impact, and responsiveness to equity. The following are the types and sources of evidence supporting the HTAC recommendations. For responsiveness to magnitude and severity, we consider the local and global data on the burden of the disease. For safety and efficacy, we use trial efficacy, immunogenicity, and safety studies, as well as real-world effectiveness, immunogenicity, and safety studies. For affordability and viability, we consider the challenges, strengths, best practices, and lessons learned from the current COVID-19 vaccination implementation. We also consider the unit cost of the COVID-19 vaccines offered to the Philippine government vis-a-vis the global market. We also consider the cost of consumables, logistics and operations, and the total available budget allotted for the specific vaccination policy. We also consider the target number of vaccinees for the specific vaccination policy and the current available COVID-19 vaccine supplies. For household financial impact, we use data from PhilHealth, including PhilHealth claims and the PhilHealth circular or benefit packages. For the social impact, aside from the efficacy, effectiveness, and safety data from trials presented in C2, we also look into the Philippine FDA emergency use authorization, vaccination implementation plans, public acceptability studies, and align it with the WHO SAGE interim recommendations for specific COVID-19 vaccine brands and guidance on the implementation of specific vaccination policies. Lastly, for responsiveness to equity, we look into the different vaccination coverage by age group, by priority group, by brand, and by region. Now, let me show you the summary of HTAC recommendations for the COVID-19. The HTAC, as of this time, has already given its recommendation for the primary series vaccination to use the following vaccines: Pfizer, Moderna, Sinovac, AstraZeneca, Janssen, Sputnik V, Covaxin, and Sinopharm for adults, while for adolescents, Pfizer and Moderna are recommended, and for children, Pfizer is recommended. There's currently a draft recommendation for Moderna for 6 to 11 years old and an ongoing review for Sinovac for 6 to 17 years old. Immunocompromised population, HTAC recommends an additional dose or a third dose from the primary series, and the following vaccines are recommended: Pfizer, Moderna, Sinovac, AstraZeneca, and Janssen for the adult population, given at least 28 days after the primary series. Please take note for Janssen, since the primary series only involved one dose, the additional dose would be counted as a second dose for immunocompromised adults. For immunocompromised adolescents, Pfizer is recommended to be given at least 28 days after the primary series. The first booster or the first dose for the immunocompromised population The following vaccines are recommended for adults: Pfizer, Moderna, Sinovac, AstraZeneca, Janssen, and Sinopharm, to be given at least 3 months after the third dose, or in the case of Janssen, after the second dose. First booster for the immunocompetent population, we recommend the use of the following vaccines: Pfizer, Moderna, Sinovac, AstraZeneca, and Janssen, to be given to the general population, healthcare workers, and senior citizens at least 6 months after the second dose of the primary series. Again, for Janssen, this will be followed after the first dose of the primary series. For adolescents, we recommend the first dose for immunocompetent population at least 5 months after the second dose of the primary series. The second booster for healthcare workers and senior citizens were also recommended using the following vaccines: both your mRNA vaccines, Pfizer and Moderna, given at least 4 months after the first booster. Let me go back to our recommendation for the first booster or fourth dose for the immunocompromised population to highlight that for HTAC, its preference are for mRNA vaccines based on the available real-world evidence on the immunogenicity and safety of a fourth dose among the immunocompromised population. This is supported by the following evidences. WHO issued a recommendation for a booster dose or fourth dose for immunocompromised persons for all COVID-19 vaccines. Different guidelines have shown that there's a higher risk of severe COVID-19 infection among the immunocompromised, and that there is an insufficient and variable immune response among the immunocompromised population even after the extended primary series or 3 doses. That there is also a relatively good levels of protection and acceptable risk-benefit profile based on short-term follow-up among immunocompromised after the fourth dose. Immunogenicity studies have shown an increase in immune response after a fourth dose compared to just receiving a third dose. Safety studies had shown acceptable short-term safety outcomes on the use of mRNA vaccines. For the second booster for immunocompetent healthcare workers and senior citizens, let me highlight the following evidences. For C1, that is for responsiveness to disease magnitude and severity, there's an increase in the number of COVID-19 infections, hospitalizations, and deaths across all age groups, especially during the period of the Omicron surge. Senior citizens had the highest number of deaths and the second highest number of cases and hospitalizations. The emergence of new COVID-19 variants also pose the potential threat of reduced protection and more rapid waning of immunity. For clinical efficacy, effectiveness, and safety, we have also evaluated the following domains. For waning protection after the first booster, it had shown that there's a pronounced waning for against symptomatic infection among senior citizens observed from the periods of 3 to 6 months, while there's a sustained protection against severe infection lasting for 7 months. For healthcare workers, there's a more pronounced waning observed versus symptomatic infection between 3 to 6 months, and sustained protection against severe infection following the same period. Please take note that there were no studies on waning of protection of first boosters of the healthcare workers, and this information is inferred from the general population. For the second domain, there's an acceptable vaccine effectiveness and increase in immune response after the second booster for senior citizens. However, for healthcare workers, there's an inconclusive vaccine efficacy due to limited evidence, but with increased immune response after the second booster. The duration of protection is not assessed due to the short follow-up period of currently available evidence, both for the senior citizens and the healthcare workers. After the second booster, it has been found out that there's an acceptable short-term safety and risk-benefit profile both for senior citizens and healthcare workers. Please take note that the mRNA vaccines are the only clinical evidence available that is used in these assessments. For C3, affordability, feasibility, and viability, we had considered the unit cost of the mRNA vaccines, which are considerably affordable compared to the ASEAN countries, and that they may represent good value for money as it is likely to be effective and efficacious based on limited evidence. Feasibility and viability, there were several challenges noted in the first booster rollout due to poor demand generation and difficulty in pushing certain vaccines due to brand preferences of the population. It was recommended that the best practices and control measures should be noted and carried over in the upcoming implementation of the second booster vaccination for healthcare workers and senior citizens. For household financial impact, we have evaluated data from Philhealth looking into the hospitalization claims, the median out-of-pocket cost, and the average financial claims. Social impact, mRNA vaccines possess most of the following characteristics desired by key stakeholders. This would include safety and efficacy, transparency in regulatory approval process, potential for high and equitable coverage, ease in logistics and administration, cost effectiveness, public acceptability, availability of mechanisms to manage untoward serious adverse events following immunizations or APs, and appropriateness of the vaccine to special at-risk groups. And for the last criteria, which is responsiveness to equity, as of May 2, 2022, which is the latest vaccination coverage at the time of this assessment, it has shown that there's a high to very high primary series coverage across the priority groups, except for the pediatric age group, which has moderate coverage. There's also moderate booster coverage across priority groups, except for the A1 or healthcare workers, which has a high booster vaccination coverage. At this time of assessment, the pediatric age group is not yet eligible for booster. While the NVOC implements the rollout of COVID-19 vaccines, the HTAC emphasizes the need to vaccinate those who are not yet vaccinated. The HTAC also highlights the importance of giving first booster doses, especially among the priority groups A1 to A3, including healthcare workers, senior citizens, and persons with comorbidities, versus giving second booster doses to the general population, since this will have a greater impact in preventing infection, hospitalization, and deaths. This is aligned with the WHO recommendation on second booster for immunocompetent healthcare workers and senior citizens, which has said that these studies show some short-term benefit of an additional booster dose of mRNA vaccine in health workers, those over 60 years of age or with immunocompromising condition. Data to support an additional dose for healthy younger populations are limited. Let me wrap up this discussion by addressing two important issues that were raised to HTAC. Why is HTAC recommending second booster for immunocompetent healthcare workers? Although there were no evidence on waning of protection of first boosters among healthcare workers, the HTAC has inferred that there is a pronounced waning of protection against symptomatic COVID-19 based on data from the general population. There is a need to preserve the healthcare system, and that healthcare workers are at a high risk of infection. It is thus critical to protect them even against mild COVID-19 infection. For the second issue, that why is there no HTAC recommendation for second booster for the immunocompetent population less than 60 years old, including the OFWs and seafarers? There is currently no evidence on the efficacy or effectiveness and safety of a second booster in the general population aged less than 60 years old. Available evidence on the efficacy and safety of a second booster only includes healthcare workers and senior citizens. And the third point, there is no Philippine FDA EUA on a second booster for OFWs and seafarers. Thank you very much.
Okay, thank you very much. Ace, that's the end na, no? That's the end.
Yes, Doc.
Yeah, unfortunately, we couldn't have Dr. Lim, but again, you'll see the hearts and the clapping and all. I'm supposed to do a summary later, but I'm like, okay, I have to watch this again. And I would say it would be a good idea for all of us to watch this video again, no? Kasi talagang very detailed, Ace, no? It's very detailed on
Saka siksik, ang daming information.
siksik, ang daming information. Yeah. So unfortunately, Dr. Lim couldn't join us, but we thank him really for putting together the presentation, and I hope later on he can be available to answer questions, no? If you have questions for us about this. Okay, so we'll go to our last speaker, and as I mentioned, we bring you only the best speakers on Stop COVID Deaths. So I met our next speaker because she was in the Formulary Executive Committee of the Department of Health, and she has fantastic work. She did fantastic work as the head of the Formulary Executive, as the head of the Secretariat of the Formulary Executive Committee, and really documents the discussions very well. And those are always very, very helpful for understanding to what extent, we are really complying with what experts recommend in terms of the use of drugs and medicines in our country. So I'd like to welcome Director 4 of the Health Technology Assessment Division of the Department of Health, Dr. Ana Melissa Guerrero. Meme Guerrero. Meme, welcome to the webinar.
Thank you, Ma'am Susie, for the very kind words, and Dr. Jason for inviting the Health Technology Assessment Council. We are really supporting po the Health Technology Assessment Council, and I hope that you appreciate that there's a lot of thinking, there's a lot of research. Hindi lang po kami nagmi-meeting, but really a lot of it goes to the hard work of the Health Technology Assessment Council. And therefore, all of you should have confidence in every recommendation put out by the Health Technology Assessment Council. Okay,
so kita naman yun, Meme. Kita naman sa presentation, no, na, before you go into your presentation, but because you mentioned it, minsan kasi parang ang iba kasi parang padalos-dalos lang mag-conclude, no? I think we have to really recognize that the Filipino experts are good, and they are doing what they can. And of course, not everybody agrees all the time, but we do have great expertise, no? You can see from the presentations in Stop COVID Deaths na ang galing ng mga Filipino experts natin, So anyway, go ahead, Meme.
Yeah. And we're very blessed, Health Technology Assessment Division, because every time that we have a deliberation, ito mga experts like Ma'am Marita Reyes gives us what is the rationale of each scientific recommendation, but I will not focus on that. My presentation will be on the harder part, the vaccine implementation and its challenges. Dr. Lims and Ma'am Marita spoke about the science. It's always a challenge to bridge the science to real-world implementation, and therefore that will be the focus of my presentation. Okay, let's now go back to what happened with our COVID-19 vaccination. Can you go to the first slide, please? So this is now where we are at. Since we started the COVID-19 vaccination in March 2021, I think thank you to the efforts of the National Vaccine Operations Center, we have reached a high vaccine coverage, at least for the primary series. That's 90.68%. That means we have vaccinated more than 70 million Filipinos. But we're lagging behind in terms of the vaccination of the senior citizens. So that's where we're focusing on at the Department of Health. However, for the first booster dose, and we have already released the recommendation of HTAC, at least for the A1 to A3, that's where we also lag behind. We only have 20% vaccination coverage for the first booster dose. Next slide, please. Let's now go to the different coverage rates according to age group. So from the slide, you will see that across all ages, we have reached more than 70% of the target coverage. However, we have very low coverage for the pediatric population, and there is really a lot of challenges in terms of the demand generation. I think we all know that there has been vaccine controversy before, and that is affecting also the confidence of the parents to get their children vaccinated. But if you look at the first booster dose, none of the priority age groups have also reached the target of 50% coverage, and more so the second booster dose. Next slide, please. Now let's go to the coverage of priority sectors. In terms of the primary series, we're happy to report that almost all sectors have reached at least 70% target coverage, and the frontline healthcare workers have the highest coverage. However, as I have already pointed out, we are really facing a lot of challenges in terms of convincing parents to have their children vaccinated. So if you look at the A3 adolescents coverage, we only have 24% coverage, and the A3 pediatric among the 5 to 11 years old, we only have 5% coverage. And if you look at the first booster dose, even among healthcare workers, we only have 50% coverage. And looking at the other priority sectors, mas mababa po yung coverage nila. So there really is a need to push for the first booster dose, considering that, one, we now have an increasing number of cases, although we have stabilized the hospital or the bed utilization rate, we still have low number of bed utilization and also ICU utilization because of the vaccination. Kaya lang po, as shown by the slides previously by Dr. Marita, there's really waning vaccine immunity, and a lot of our population really has no booster dose. Only 20% has the first booster dose. So you could imagine that the vaccine immunity of a large portion of our population has waned, plus the emergence of the Omicron subvariants. I think USEC Guerrero just announced that we have the latest Omicron subvariant that was found by the UPNIH. And if you look at the second booster dose, so there's a lot of talk on pushing for the second booster dose, but how can you push for the second booster dose when we don't even have optimal coverage for the first booster dose? Next slide, please. Let's go to the next slide. So let's look at the disparity in terms of the coverage across the regions. NCR has the highest coverage, more than 107%. I think this is because a lot of the vaccinees are also coming from the other regions and provinces. But here, you will see that BARM, as expected, because BARM has really been consistently having low performance even for our national vaccination program, they have below 50% coverage. And in terms of the number of first booster dose, again, all regions have failed to reach the target coverage of 50%. Next slide, please. So just highlighting that except for BARM, we have reached high to very high coverage across all the regions, but there are logistical issues that we face with regard to BARM and other isolated areas in the Philippines. Next slide, please. So what are the challenges encountered during the COVID-19 vaccination rollout? We're closely coordinating with the National Vaccination Operations Center because HTAC really has to consider what are the feasibility and implementation challenges. And these are some of the factors that they have noted during the implementation. Dr. Lims has spoken about there are vaccine brand preferences. So for example, a lot of Filipinos would prefer mRNA vaccines, whereas some sectors would like the traditional vaccine platforms like the inactivated. And this affects sometimes the rollout because the preferred vaccines may not be at the site, and therefore the vaccinees may defer the vaccination. There's also difficult demand generation despite the consistent campaign of the Department of Health, particularly among the pediatric and the adolescent population because of the previous controversies that we have faced, for example, the Demvaxia controversy. And I've already shown you that there are regional disparities in vaccination, particularly those areas where it is difficult to reach. So it's difficult to transport the vaccines via planes or via boats. So you could understand why you would have low vaccination rate in some regions of the Philippines. And insufficient human resources. This has been a problem even before the COVID-19 vaccination program. That's why we had a low vaccination rate before for our traditional vaccines. and really the COVID-19 vaccination program, where we were directed to vaccinate at least 70 million Filipinos, has really put a lot of pressure to the health system. And given that, for example, in the national vaccination days, which we implemented in November 2021, a lot of Filipinos really went to the vaccination centers, and that also resulted in the fatigue of the healthcare workers. And sometimes there are errors that were noted during the vaccination. I have already told you that there are difficulties in distribution. So particularly in LGUs where they do not have the ultra-low freezers for the mRNA vaccines, or it may be difficult to reach those areas because you have to transport via plane or boats. Next slide, please. And these are also some factors. So there are logistical factors. There are also informational factors. According to the National Vaccine Operations Center, there's poor demand generation for booster doses. And Filipinos tend to think that because we already had the primary series, then we don't need the booster doses. Further, loosening of restrictions and opening up of the economy during COVID-19 vaccine implementation compounded the problem of demand generation. Next slide, please. We regularly do surveys. So meron tayong mga SWS quarterly surveys. We also have the Johns Hopkins dashboards to look at what are the enablers and barriers of vaccination. Here is a recent survey that was conducted by the Department of Health sometime in May 2022 to look at the determinants and the factors of why Filipinos are not getting boosted. As I have said before, majority of our people think that we are already good because we have the primary dose series and they don't need the booster doses. But a lot of the factors really are anchored on fear of the side effects and concerns that they will not be supported if they have the side effects. Also, it's not helpful that there is no requirement for work, school, or entry into public places if you don't have the booster. Also, the influence of friends and relatives who are not also getting vaccinated. There's still a perception of low vaccine efficacy and incremental value of being boosted over the primary doses, and no incentives available for booster vaccination. So I will not anymore speak about the other factors. So these are the top reasons why we still face a low vaccination coverage, particularly for the first booster dose. Again, the question, how can we push for the second booster if we have not even reached the optimal coverage for the first booster doses? So this is where we really need to work on, especially now that the immunity has waned. So when were you last vaccinated with the primary series? So 4 to 6 months, you will expect that the immunity has already gone down. Next slide, please. What are the plans of the Department of Health to address these structural and informational barriers when it comes to the booster doses? So we're now planning to have vaccine mandates. And this was proven when we launched the National Vaccination Days in November, where we reached 90% coverage for the primary dose series. And we are also proposing some additional vaccine mandates, like as shown by the previous resolutions of the IATF, where we require testing for unvaccinated workers or public places refusing entry for partially or unvaccinated in public places. Next slide, please. And there are also best practices that we can adopt in order to further boost or convince our populace to get boosted. Balancing the communication to highlight the benefits of the vaccine more than the side effects, which are really, we have low rates of side effects observed during our actual implementation. Of course, the hotlines for reporting the adverse events should always be there, and the availability of medical support for handling the AEFIs. One of the barriers that we saw was that the preferred vaccines are not there, or when people go to the health centers and they don't see, for example, the mRNA vaccines that they prefer. So what we need to do is to bring the vaccination sites closer to people. LGUs really have a huge role in doing this, for example, by incorporating COVID-19 vaccination program in our health centers, or working with other sectors like the workplaces, the schools, so that we can arrange for a vaccination day, so that would also wrap up the vaccination, and also leveraging the influence of community partners and private sector who are supportive of the vaccination efforts of the government. Next slide, please. This has already been announced by Yusek Guerrero in our media forum. So we are now redefining fully vaccinated to include the first booster shot and to increase the vaccine uptake. And we will also work with the other sectors of the government, like the Department of Interior and Local Government, to also mobilize the LGUs. For the employers, we will work with the Department of Labor and Employment and the Civil Service Commission. Of course, for the schools, we have to work with DepEd and CHED to make schools as vaccination sites. And the goal is to achieve a wall of immunity. What does it mean? So we have to reach a high coverage across the general population. That means 90% primary series for the rest of the population, and at least 50% booster coverage for A1 to A3 to protect the most vulnerable. And who are the most vulnerable? Of course, our elderly, the immunocompromised, children who are not yet eligible for booster doses. So this is my last slide, I think. So for the last slide, we will just explain what we mean by achieving a wall of immunity. So this means a high level of vaccination, primary series and boosters in the community will help us achieve a wall of immunity. Of course, this has to be implemented with the minimum public health standards. And by doing this, we will protect the most vulnerable population. It will keep our healthcare system ready and prevent transmission of infection to the rest of our populace. And therefore, this will allow safe and responsible movement of the Filipinos by keeping our families together and our economy running. Thank you very much, Ma'am Susie, and everyone who's watching this webinar. And we will now welcome questions from the floor.
Okay, thank you very much. It's Dr. Melissa Guerrero from the Department of Health. Again, you'll see the appreciation of our audience. Meme, no? Tingnan mo yung mga emoticon, ang daming lumilipad. Okay, very, very, very good presentation, I think, which gives us a little insight into what are now some of the practical considerations, no? Why we need to focus on a higher primary series coverage, and the first dose or the first booster coverage for the priority groups need to be increased. So we're going to ask our panelists to kindly open your cameras. So Dr. Ma'am Marita and Meme, because I think we won't have Dr. Lim, no? Ace,
yes.
No, we don't. Okay. So Ma'am Marita tsaka Meme, please open your cameras. But before that, we will have a public service announcement from TVUP. Go ahead, please.
Aloy, bilisan mo! Dali! Wala!
Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate! Nabakulahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yay!
Sisiw!
Kaya mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center.
Okay. Doc Susie, that public service announcement is actually one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 to 18 years old.
And I think Ace, after this webinar, I don't know, maybe nag-iisip na si Ma'am Gigi si Rika nito, but really, I think the communication campaign now regarding boosters and really high coverage for the primary vaccine series needs fresh communication, no? So apparently sa mga bata mababa pa rin ang coverage natin, no? Okay, so I think you have
Yes, Doc, we may isa pa tayong gustong i-plug, no, for our viewers today. Now, of course, before we go to the Q&A, just wanted to remind everyone, all of these materials are available on social media. So because we are all health promoters now in the pandemic, we highly encourage you, please share this message, that public service announcement, with everyone that you know. Parents, guardians, carers, lahat ng mga kakilala niyo sa social media, magpasama na sa bakuna center para we can raise those numbers and build that wall of immunity that Doc Meme mentioned earlier in her presentation. Now, we know that everybody's also busy and sometimes hindi po kayo makakasama during our lunchtime webinars. Don't worry, we have actually selected some presentations that we will feature in the TVUP YouTube channel that we've lovingly called SCD Short. So in case you don't have time to join us during these lunchtime webinars, you can go to the TVUP website, browse through the catalog, and then listen to the different presentations there, including the presentations that you heard just today. Okay, so Doc Susie, why don't we get this panel discussion going? Over to you.
Okay, thank you very much. So I think we've got a number of questions, no? Is baka you want to look in the Q&A box and so on. But I wanted to start the discussion by asking Ma'am Marita and Meme. So I think from the scientific point of view, HTAC has provided the guidance. Okay, so may guidance na. Now, Meme has talked about the implementation gaps and barriers. And I think information and communication about the importance of doing this in a stepwise manner has been articulated. We talked about this last time, but I want to bring it up again, no? Emma, you mentioned 50% lang ng healthcare workers actually were boosted. What do we need to do to, because the healthcare workers provide, aside from frontline care, they also provide frontline communication. So itong mababang coverage ng senior citizens, matagal na namin nakita yan from the very beginning, and we were already doing some public service announcements on that also. Now we're talking about children and we're talking about immunocompromised, no? So in terms of the approach, how do we approach this? What are your thoughts on how we can communicate that the situation is now different? Kasi yun yung na-pick up ko sa sa conversation, is that the situation is fluctuating, it's always changing, right? But somehow, because we've opened up and because a lot of people got their vaccination, parang tapos na, parang ganun yung feeling ko. So what do you think we need to do in order to communicate this in a better way? Maybe I'll start with Ma'am Marita.
Alam mo, Susie, ang ganda-ganda nung inyong cartoon kanina about the two children na nagkaroon ng wall of protection. Dapat siguro meron din tayong ganon para sa mga matatanda at meron din tayong ganon para sa mga healthcare workers. But what we have to emphasize sa ating health workers, at least kasi may mga institutions sila, these healthcare workers belong to institutions, so there should be an institutional policy.
Correct.
Regarding vaccination of their healthcare workers. So, kasi covered sila ng mga institutions nila eh. So, our organizations, kind of talk to our healthcare workers and be the model. They should model yung receiving the booster doses. At pag nakikipagkwentuhan sila sa kanilang mga pasyente, yan ikukwento nila na sila meron ng second booster or meron na silang first booster. Para lumakas ang loob ng ating mga pasyente.
Yeah. Meme, what are your thoughts on this?
Then communication, Ma'am Susie, just like what I said in my presentation, there really has to be a cross-sectoral approach. There has to be enabling policies. For example, in schools, that's why we need to partner with schools in order to make school settings for vaccination. Sa health, we are also redefining the fully vaccinated. I think that has been the gap here because everyone thinks you got the primary series, you're okay na. But now we really need to hammer down the message that the immunity provided by the primary dose series is waning.
Correct.
And therefore, you really need to have your booster, especially now that we have emerging variants, although the vaccines also have reduced efficacy, but somehow it brings back your immunity up to a level where it could prevent symptomatic infection, especially for the healthcare worker. It is more than just messaging. There has to be enabling policies dun sa different sectors that are affected. Sa schools, in hospitals probably, for example, in PGH, you can have encourage the healthcare workers. You cannot, I don't know, maybe that's controversial, requiring the healthcare workers to have boosters before they can report, because we have done that for the primary dose series.
Right. I mean, while we're talking about communications, I mean, Ace is a communications expert himself. No? Ace, what is your thinking on this? Kasi parang tama yung sinabi mo, Meme, na parang nagwe-wane na yung immunity, di ba? Tapos may bagong variants. Kumbaga, parang dati may baha, di ba? Ngayon, bumaba, sa tingin ng tao, dahil bumaba na yung tubig, pwede nang magtampisaw ulit. Pwede wala ka nang pagtatampisawan. Parang it's dry. The land is already dry, but it's not, because it's still raining. You know, it's still raining. So I think that's a bit of a challenge, no? Kasi we sort of campaigned on get your vaccination for protection, and so now people think they are completely protected.
Tapos na.
No? Anong tingin mo dyan, Ace? Ano ang mga communication hurdle? Although I know what you're saying, Meme, no, na it has to be accompanied by institutional policy. I agree completely. Pero even to change institutional policy, you need to be able to communicate that to the institutions. Diba? They have to buy into it. Ace, anong tingin mo dyan?
Ako, Doc, first of all, having forums like this is always important, and storytelling also. When we opened the webinar, you shared that you are fully vaccinated, boosted, and yet you got it, and your experience was nowhere near mild. You had very relatively bad symptoms, but we know with the medications that you took, and probably because of the boosters that you took also, it didn't take a worse course. So I think it's good to hear from fellow health workers also about their own experience. And if you remember, in the beginning of the pandemic, that was really one of the things that moved a lot of people within our community, right? To really take action. When we saw colleagues getting sick, some of our dear mentors actually passing away from COVID-19, that was a wake-up call that we should take this seriously. So I think storytelling is important, really hammering down these messages that yes, the pandemic is still here. This virus, as wily as it is, continues to evolve. But I totally agree with Doc Meme's assertion earlier. No? Parang there needs to be a reframing. If we talk about fully vaccinated and we limit that to just getting your primary series done, okay, mission accomplished na ako, diba? And to be fair, we have we have very, very high vaccine coverage for primary series, but we have to reframe that in the same way that, as healthcare workers, naalala ko yan diba, sa duty, kailangan may presence of mind ka because you never know what's gonna come through those doors. These kinds of messaging, these kinds of conversations have to happen. And siguro, without really giving a full answer, I think it's also important to listen. So I appreciate, for example, the efforts of the Department of Health in doing these surveys, doing these focus group discussions, looking at the dashboards, because as we know, diba, in communication, Doc Susie, the number one rule is to listen first and understand before we speak. So let's find out, why are our colleagues, for example, not leading by example and only 1 out of 2 health workers are boosted? Maybe there are other concerns na go beyond, for example, communication that we need to address.
Yeah, I mean, I think I mentioned this before, but I'll drill down on it again. Ako naman, parang ang tingin ko, Okay, so okay tayo dun sa ano, no, I like your point, Ace, about we need the stories of the frontliners that you can get infected again, okay? And that it's not a walk in the park. Well, not for everybody, at least, no. Na ano no, parang bibigyan natin ng mukha yun. Kasi just saying that this, you need to do it, right? It's not the same as why do you need to do it, di ba? Parang we cannot just prescribe and say basta. Di ba? Basta magpa-boost kayo,
Lalo
di ba?
na mga healthcare workers, naku, notorious na matitigas ang ulo niyan. Because of course of our education, we think we know better, and sometimes we don't, and we need a little nudge in the right direction.
Yeah, so I think the narratives of frontline workers very important. But I wanted to point out what I was talking about last week also, na we have to articulate risk not from the point of view of the individual only. Kasi that's a very Western concept na parang kailangan ikaw gantong gawin mo para hindi mangyari sa iyo ito or para mangyari sa iyo ito. And we've seen that in whether we're talking about the treatment of diabetes or tuberculosis or whatever it is, no, that the household plays a very important role in the what should I say, in the management of or the spread of disease, whether that's communicable or non-communicable disease, no. So in the case of, let's say, diabetes, if in the household you're really eating low fiber, low fruits, vegetables, etc., high sugar, high processed food, the whole family has that risk. The whole household has that risk. In the same way now, if we're looking at those groups that have low coverage, no, children and senior citizens, we should have a way of enabling a family to say, okay, dahil meron kaming mga bata at saka mga senior na hindi bakunado, ang risk natin lahat dito magka-COVID ay ganito kataas na. No, parang compared to those who have vaccinated seniors and vaccinated kids and continue to follow the minimum health standards, then you have a lower risk. So I think we need to really think through how we are talking about this. We are still, well, the Western world kasi talks about it as individual risk, but in Asia and in the Philippines, this is about the household. Kaya yun yung kanina pinag-uusapan natin, Ace, no, na ako, I got it from my son who is a young person na maligalig, di ba? Parang ibig sabihin nun, hindi ko iniisip na yung risk ko mas mataas. Pero boosted rin yan, ha?
Correct.
Boosted rin siya. So, I think we have to rethink a little bit what we're saying so that people will understand why they have to do certain things, not just
Siguro, Doc, Susie, masingit ko lang. Of course, messaging is important, no? But taking a broader health promotion point of view, we also have to look at contexts. What are the situations where people might be more receptive to receive our messages? We're, taking a siguro social marketing approach, di ba? Sabi nga nila, what is the product? In this case, the product is protection. How do you promote that to these different groups? Maybe we can look at different settings. Kaya, again, I emphasize, highlight what Doc Meme said earlier about working with different stakeholders. The school is such an important setting, not just for health promotion messaging, but actually to reach the parents, to reach other stakeholders. So looking at these different settings, workplaces, importante din yan. Very, very important. And of course, getting very public health messaging, a whole of society response nga, di ba, ang gusto naman talaga natin for this pandemic.
Go ahead.
No, I was just gonna say, Doc Susie, we have a lot of questions kasi now on the chat. If it's okay, can we go to maybe one or two muna? And I wanted to direct this to Ma'am Marita. Ma'am Marita, you talked about the concept of waning immunity earlier and also about the different recommendations of HTAC. We have a question here. For those who are immunocompromised, who have completed their 3 primary doses, meron ba bang planned booster dose for them in this risk group? Can you clarify that for us? Kasi I think, there was a mention earlier that if you're immunocompromised, your primary series consists of 3, not just 2. So, na-complete ko na po yung 3. Paano po yung booster after that?
Susunod na rin yun. Dapat meron na rin siyang booster. Siguro
Okay.
ano po yung ating yung first booster. In other words, it will be the first booster for the immunocompromised. Parang mas shorter ang shorter ba? Limbs? Limbs is here na eh. Meron
andito na si
si Limbs.
Okay.
Yes.
Yung natin.
Hello, good afternoon.
Ayan. Thank you, sir, for joining us.
Is my signal okay po? Sorry.
Yes.
Clear po, sir. Very loud and clear.
All right. Sorry, I missed the question, ma'am.
Yung first,
You were saying about
hindi ba yung immunocompromised, we said that yung third vaccine nila is only to complete yung kanilang primary series. But they should also get a booster. So that will be their fourth injection. Meron ba tayong pinidescribe na period between the last vaccine and the next one as the first booster for immunocompromised?
if we're talking about the third dose, ma'am,
Lim, I'm gonna interrupt lang. Can you remove your mask? Can you remove your mask?
Ma'am, nasa labas ako. So,
ganon.
sige.
O sige. Kasi you've got more than 1,000 people who want to see you.
All right, ma'am. Nasa labas.
Wow.
Pag naka-COVID ka, hindi ko kasalanan na. O sige.
Sabi ni Meme, mga 3 months at least.
Yes, ma'am, I agree po. So, our recommendation is at least 3 months po. After you receive, this is for the immunocompromised population.
Okay, thank you for that clarification. We have another question, and ito, Doc Susie, medyo controversial. Tingnan natin kung paano magre-react ang ating mga speakers. So, this next question, I'll direct to Ma'am Marita and Dr. Limuel as well, now that he's joined us. Now, in the news article earlier that was shared, it was mentioned nga po that some vaccine manufacturers are already working on a vaccine that will cover for other variants. What I read was they're looking at a bivalent vaccine that will cover, including for Omicron variants. So the question that was posed in the chat is, if these vaccines, or rather these boosters, are coming along anyway, why don't I wait for that na lang? Hindi ba better yun? Hintayin ko na yung booster na mas may coverage with these Omicron variants rather than getting one now na hindi naman, let's sabihin na natin, although we know that it does confer some protection, still, hindi naman siya designed specifically for Omicron. Any thoughts po regarding that?
Kasi parang it's better to have the egg. Ano yung kasabihan about being about the egg in your basket already? Huwag ka nang kasi you don't know what will happen between now and when that new good vaccine comes out. So while you're waiting, you are at risk of being infected because there is waning of your protection.
Right.
So you go ahead and have your vaccine, your booster, and then of course, meron din kasing tanong na ilang boosters ba ang kailangan? I think that what will happen will be something like the flu vaccine, the local vaccine will really have it periodically because there will the COVID-19 will be with us like the other viruses, and they will be seasonal surges regarding this infection. So I think that in the long run we'll include COVID vaccination among our immunization programs, periodic immunization programs na. So all of the rest therefore will be boosters na lahat yan.
Right. I think, ma'am, the expression you were looking for is don't count your chickens before they hatch. Baka may mga itlog nga na naghihintay, pero wala pa, regardless, and it's good that our vaccine manufacturers are looking at more comprehensive vaccines. Pero wala pa dito eh. While we're waiting, nandito na, kunin nyo na. Di ba, ma'am?
The bird at hand.
Oo nga.
Is better than some other.
Yeah, no, I mean no, I remember in the early days, right, when people were saying, should we wait for Moderna or take Sinovac? And the
Yes, oo
answer
nga.
was the best vaccine is the one that's in your arm.
Right, oo.
Same thing, no? Parang ano habang I like that, Ma'am Marita, no, na while you're waiting, you're at risk, and not you only, your whole household is at risk.
Correct.
Diba, you're putting other people at risk. I think Meme raised her hand.
Yes.
Meme,
Yeah, so it's not just when will the vaccine come. We're happy that these new vaccines are these new versions of vaccines are being tailored towards the new variants. But when will they come? The second question is, will the Philippines be prioritized by the manufacturers? Remember that there is equity in terms of the global access. And our experience has been, mauuna yung Western world bago makarating yung mga mRNA vaccines. They will vaccinate their populations first before us. So that's another factor.
Yeah.
So loud and clear, no, Doc Susie, in answer to the question of the headline, should I boost now or wait later? Boost now. Especially kung eligible ka na. So I think that's the other point. No? Kung eligible na po, magpa-boost na tayo because there's clear evidence that it will confer added protection as your immunity wanes.
And we're also talking about the the increasing the primary coverage of the seniors and children. No, so ito yung sige, go ahead, ma'am.
Yun nga ay papaspasok ka na. So
yes.
The children will be at risk. So we should really increase the coverage of children. So primary lang Primary series pa lang mababa na ang children.
Right. Alam mo, Ma'am Marita, the other thing that I like that you said was, this is probably going to be a continuing thing. Kasi parang ang tingin ko yung common yung conventional wisdom is that ay nabakunahan na ako. We have not, we have to emphasize that it is not lifelong immunity that is conferred by the vaccines that we gave.
Right.
And so we have examples like the flu vaccine where you have to take probably a different one every year. So kailangan i-communicate natin yan na hindi pa tapos yung pandemya, nagbabago-bago yung mga yung nagbabago dahil sa variant, at kailangan magkakaroon tayo ng booster, siguro iba-iba yan every year, no? Mag-ready na tayo na ganun. Kung gusto nating maprotektahan lahat ng mga mahal natin sa buhay, no? Kasi yun nga, no, parang anyway, Ace, you wanted to say something.
I wanted to point out, Doc Susie, I think and maybe this is probably going to be a longer conversation, but I wanted to highlight the point that you made, and si Ma'am Marita nga. I think people are waiting for some kind of official declaration na, okay, as of tomorrow, the pandemic is over, therefore we go back to life as it was before. But siguro nga tama nga yung ganung point of view, Doc Susie, no? It's less about waiting when this pandemic will be over, whatever that means, but rather maybe it's accepting the fact that our life has changed.
Yes.
Our way of life has changed, our perspective and how we keep ourselves safe and protected has changed, and therefore we have to change the way we understand and accept all of these different vaccines. Changing behavior takes time, but changing culture takes longer. So siguro baka culture shift na ang kailangan natin gawin.
Yeah, I think we have sort of hit several important points in communication by talking about the boosters. And so we are running out of time. We have to go to the answers. Let's go to the answers to the fun quiz. Sige, go ahead.
Okay, so if you remember, we had asked you to answer 2 questions, and I wanted to get some reactions from our panelists. Okay, so our first question is, alin ba ang mabibigay ng mas mataas na COVID-19 immunity? So 79% said, at least in Zoom, that COVID-19 boosters would provide higher immunity. Natural infection, 21%. Okay, so I'm just checking also on the other. Okay, so ganun din, COVID-19 booster, 74%. Natural infection, 26%. Ma'am Marita, Doc Meme, any thoughts on this? Mukhang aligned naman tayo sa ating mga messages, sa mga sagot ng mga tao.
Galing sila, alam nila. Pero sana yung 29% na naniniwala na ang natural infection will give you better or higher immunity, magbago na sila ng isip, no? After the presentation at pagkatapos nito, hindi na yon tama.
Oo nga, as your lecture pointed out, ma'am, no, talagang mas stable and mas consistent yung response talaga with boosters.
Mas mataas.
Correct.
Yan,
Okay.
bumababa na. O bumababa na yung number na.
Nagbabago na ng isip. Okay. This second question, siguro si Doc Meme can comment on this. Kasi it really talks about yung prioritization, the operations, etc. So who should be prioritized? Sino ba dapat unahin sa COVID-19 boosters? So number one, no, pinakamataas, healthcare workers, 79%, followed by the immunocompromised, 77%, seniors, 72%, economic frontliners, 36%, and student and teachers, 26%. Dun sa other poll natin, ganun din, healthcare workers ang nauna, followed by the immunocompromised, then seniors, economic frontliners, and then students and teachers. Doc Meme, any thoughts on this? Ito nga bang pina-prioritize natin sa ating rollout ngayon?
I think in the most part, so yes, we do prioritize the healthcare workers, that's the A1. A2 is the seniors, and then the A3 yung mga immunocompromised na with comorbidities. But right now, we don't have any recommendation yet for the boosters of the economic frontliners. Ito kasi yung mga immunocompetent, as explained by Dr. Lims, and also as explained by the WHO, wala pa kasing evidence that the booster can really have additional benefit for the immunocompetent.
Okay, thank you, Doc Meme, for that. Okay, Doc Susie, grabing usapan natin today. No? And as usual, kulang na naman ang oras natin for all of these comments kasi people keep sending questions. So anyway, let's see, na maybe we can answer that later on. But for our participants in Zoom, we kindly request you to answer a very short panel evaluation poll. So you can see that poll right now. While Doc Susie asks our panel to give their parting words to our viewers, your feedback will be highly, highly appreciated. So Doc Susie, maybe you can invite our speakers now to deliver their final remarks, closing remarks, while our participants in the Zoom room answer the panel discussion poll.
Okay. So yung evaluation natin yung ACE, no? The evaluation.
Yes.
I think usually the audience wants it flashed on the screen. I-flash ba natin yan?
Sige, Doc. Hintayin lang natin while the people answer, no? Okay. So we're getting a couple of responses already on the panel discussion poll. Okay.
Yeah.
Sige.
Okay. So so we're gonna give our audience some time to fill up the evaluation. But you know, there's a comment here from Dr. Santos Ocampo that I don't wanna bypass her question.
Sige po.
So she's got a question here na okay. Baka pwede natin sagutin. So our speakers, can you take a look at the question?
Which question po to, Doc Susie? Is this the one about first booster dose not yet maximized?
Yeah.
Or sige, okay. So there's a question here, Ma'am Marita, from Dr. Santos Ocampo. The first booster dose has not yet been maximized in our population. In effect, we don't have a good large study population to monitor the effect of this booster and any data to look for adverse effects. Should we include the number of first boosters first before pushing the second booster for the immunocompetent? As far as I can tell, second booster seems to be close to marginal on effectiveness. There seems to be a ceiling effect as well. So, makakatulong ba talaga itong second booster?
Okay.
May pakisagot nga yun. That's the, yun yung that's the context of our recommendation with regards to second booster. We're looking for a certain level of first booster muna sana before we
Mhm.
push for the second booster because of your comment. Your comment is very valid, no? And
Right.
also our concern. Pero ang tanong naman kasi ng ibang tao, if we're talking of areas, for example, like in the NCR, na mataas na rin ng konti yung first booster, pwede bang umpisahan na rin dito ang second booster?
Mhm.
Hirap kasing sagutin yan. It all depends on supply
Yes.
at saka yung yung framing ng programa. I wanted to comment kanina na our attitude towards the prioritization groups must be that it is the context lang, inuuna lang sila because of supply limitations. But we would like everyone to have the vaccination. Ganun lang yon. Hindi sinasabi na hindi kailangan sa iyo. Ang sinasabi lang, unahin natin sila kasi they are the most at risk. Pagbibigayan lang. But everybody should have that. So, talagang dilema yung tanong mo, no? So,
It's okay, ma'am.
Ako yung tatanungin and I'm like, let's say, ready for a second booster. Yet nag-aantay ako so that the first booster will have a higher coverage. Nakakainip din eh. There is a psychological impact din. Nag-aantay ka and yet ang bagal-bagal namang makaabot ng mga first booster ng kanilang limitation. No? Mabuti na lang hindi ako yung final decision maker. Kasi, kasi I can understand. And ang hirap sa kalooban. So in the end, it will have to be the political will, the understanding and compassion to the different kinds of needs of people.
Yeah, thank you so much. Thank you, Ma'am Marita. No, I mean, just to add to that, Ace, and I know we're actually going overtime already, but I think the point is when we say everybody should get the first, I mean, those who are in priority should get the first booster. Trabaho ng bawat pamilyang Pilipino yan. Kasi parang parang we're saying everyone should do it, but nobody's acting. So every family, every household has to play their part, do their job. No, and so it's not really the government. It is really the people, the families have to make sure na nagbakunahan yung mga seniors nyo. Kayo lang naman makakakumbinsin yan eh. Hindi naman kayang kumbinsin ng iba yan eh. Anyway, nako, I know there's a lot we want to talk about. We have to wrap up.
Yes, oo nga.
Okay, so we're going to give our panelists a minute to formulate their parting words, but let's go to the results of the poll.
Okay, so let's look at the results of the poll now, and we'll be sharing that so people can see the results of the poll. And well, anyway, I can see it here. No, eventually you'll see it on your screen. As expected, rave reviews from our Zoom webinar participants for both speakers. Over 95% said that they strongly agree that our panelists demonstrated a thorough knowledge of the topic and that they spoke very clearly and that appropriate language was used, hindi masyadong technical, tama lang, and that they contributed to new perspectives and knowledge on managing various key health issues. So thank you so much, Ma'am Marita, Doc Meme, for a wonderful presentation. Kitang-kita niyo naman from the reviews, over 90%. Sana ganito din kataas yung booster coverage natin. And maybe eventually, di ba, over time, and hopefully this webinar contributes to that target. And for those who are eligible to get boosted, pa-boost na po kasi madami rin po naghihintay. Kung kayo na po yung nasa harap ng pila, so to speak, magpa-boost na kayo kasi meron po pong susunod sa inyo na naghihintay, gusto na rin po magpa-boost.
Okay, so we'll go to the parting words. We'll start with Dr. Meme Guerrero. Go ahead.
parting words si Ma'am Marita na because amen ako kay Ma'am Marita. But
Hindi,
yun po, please have confidence that every HTAC recommendation has gone through very thorough review. They think about it, we meet for hours, and therefore, kapag po nilabas yung HTAC recommendation, they look at everything. And it's now up to you to make that decision whether to get boosted or not, but essentially po, HTAC has enabled already. Get the booster because it will benefit you and your family. For the Department of Health, we're looking forward to really open up the economy, open up the schools, and therefore your cooperation in our program to boost the coverage of both the primary series for the elderly and the booster for the A1 to A3. That would really help so that we can all go back to normal. Thank you very much for this forum.
Okay, thank you very much. Let's have Dr. Lim, please go ahead.
We would like to take this opportunity to engage our viewers. Okay, so we have given you this information. Sabi nga kanina, I was tuning in while in transit. So masyadong compressed yung lecture kanina. Maraming information. We have our executive summaries and briefers for all the HTAC recommendations for COVID-19 vaccine, and you can actually check it out in the HTA website so that it would help you be informed of the information that you will also be sharing with your patients and their families. So we would want to engage you to be our partners in educating our patients and their families so that everyone would also be covered, not just by the primary series, but eventually with the booster doses. Thank you.
Okay, thank you very much. Ma'am Marita, kayo po.
I echo the advocacy of the two earlier speakers. But what I would really want to emphasize is that we hope that you use this knowledge, this information that you have just obtained from this webinar as basis to convince others about the need for vaccines and boosters. No? So use this knowledge, this information in spreading the word. So you become one of us, one of the advocates, and use this knowledge to convince other people for vaccination and boosters.
Okay, thank you very much. That was the head of the Health Technology Assessment Council, Dr. Marita Reyes, and thank you to Dr. Lim and Dr. Nene for. We don't have Menchit or Charlotte or Stella to do the closing remarks today. So I'll just do a very quick summary of what our speakers talked about. And then we'll cue you on what we're going to talk about next week. But I realize we're over the time, so I'll just make this really quick. So Dr. Marita Reyes talked to us about different types of the immune response. So cell-mediated versus the humoral immunity. And in the humoral, this is a review on how the body can produce antibodies. But at the same time, there is cell-mediated immune response, which means we have T cells that can actually lyse infected cells. Now, she also reviewed with us the antibody response graph, where we see how the IgM rises ahead of the IgG, but the IgM quickly declines, and the IgG tends to remain a little longer than that. So this brings us back to understanding the incubation period, the relationship of the antibodies to the symptoms of the person, and what would be the effect of vaccination on the immune system. So it was very clear. Dr. Reyes was saying that vaccination mimics an infection, but it produces higher antibodies than a natural infection. So in fact, getting vaccinated is truly the best way to gain protection against an infection. And in the case of COVID, the booster really gives us higher levels of IgG. Now, she also talked about two things, and this was also covered by Dr. Lim. the difference between the immunocompromised and the immunocompetent. So for the immunocompromised, they have already created what we call the 3-dose as the primary plus a booster. And Dr. Memia also mentioned now that for the immunocompetent, it's already full vaccination is already going to be considered 3 doses. So the 2 primary plus the booster. So there are changes in the definitions, and the reasons behind this is because the protection is waning, there are variants, and for some reason there may be inadequate protection or possibly higher risk for the individuals or the families, as we have discussed. So the duration of protection actually is changing and is not fully or completely understood, and therefore the boosters can help keep your antibodies up and not allow you to become at high risk for a serious infection. Now, Dr. Lim talked about the evaluation framework that HTAC is using. I won't go into the details of this, but I highly encourage everyone to watch this webinar again if you want the details on what the HTAC recommendations are. And he did talk again about the immunocompromised and the immunocompetent and the difference between that. He also talked about how mRNA is effective in the immunocompromised and the immunocompetent, and that's what we're using for boosters. No, the other vaccines are not really. We don't have enough evidence that they can be used for boosters. Dr. Guerrero talked about the vaccine implementation and its challenges. So it's not enough for us to know the science, but we also have to understand where the Philippines is in relation to vaccination. And we do have 70 million Filipinos who are vaccinated, but we have not covered enough. And in fact, there are places in the country, so ito na nga yung sinasabi niya, merong mga region na naka 33%, less than 50% in coverage. And for the A1 to A3, none of them have reached 50% of the first booster. So we have to really collectively work together in our families and our homes to make sure that everyone gets the primary dose, and those who are in A1 to A3 get the second, the boosters, because they are now available. So she talked about different mandates that might be used, the need for social mobilization, and I think more importantly, she talked about the importance of institutional policies, particularly for our health workers. So that's my summary. Of course, I'm not a Menchit Padilla or a Charlotte Chong or a Stella Ato, but I think we really covered a lot today. It's been a great webinar, and I encourage you to join us next week. Naku, maganda po yung topic next week. So please join us next Friday. We will have 2 of the outstanding infectious disease and epidemiology experts of the country. Our topic is dumadami ang COVID, sino ang tinatamaan? And Dr. John Wong is going to present new data on the increasing number of children who are getting COVID. This is very important because we were saying napakababa ng vaccine coverage ng mga bata. Okay, so we'll have Dr. John Wong, and then we're gonna have Dr. Isa Alejandria, who has been awarded. Actually, we'll talk about the award next week, but awarded for her work on COVID-19. Okay, over to you, Ace.
Thank you, Doc Susie. Now, before we conclude our program, let us, of course, again acknowledge all of the different groups and organizations that were responsible in putting this program together. So thank you very much to the University of the Philippines System, the UP Manila National Telehealth Center, the UP Information Technology Development Center, TVUP, the Internet Television Network of the University of the Philippines, UP Philippine General Hospital, and everyone who has helped make this award-winning learning series possible. And finally, all Stop COVID Deaths webinars are archived for your convenience and your viewing pleasure at the TVUP YouTube channel. So in case you would like, sabi nga ni Doc Susie, gusto niyong balikan yung mga presentations today or from previous episodes, just go to the TVUP YouTube channel and you can scroll through the different episodes and lectures there at your convenience. Grabe, Doc Susie, what a full discussion we've had. Of course, before anything, I don't know if you noticed, but some people were wishing you well. So I hope that you
Yeah.
continue to feel better. I'm sorry to hear that you got COVID, but it seems
Oh.
like you're on the mend, that you're able to join our episode today. And to whoever who's watching us who is maybe going through COVID themselves, we hope that you continue to get better also, and that everyone stays healthy and protected.
Thank you so much, Ace, and thank you sa lahat ng mga who sent the kind words, no? Yes, I'm getting better and I am boosted. So lahat kayong mga frontliners, pwede ba magpa-boost na rin
Oo
kayo?
nga.
Kasi delikado. Anyway, okay. This formally closes our webinar for the week. I'd like to thank again all our speakers for the excellent presentations and our audience for staying with us a little bit over time. So we look forward to your company again next Friday. It's a date.
Together we can stop COVID deaths.
Okay, so on behalf of Raymond, stay safe, stay healthy, and see you online.